As most of you know, my general approach to surgery is that the best surgery is the one you never had. Sometimes, however, either due to an injury or a condition that has failed more conservative treatment, we have decided to treat the condition with an operation. I am very fond of saying that no one has made me all-knowing or all-powerful yet, so I cannot make a perfect guarantee of how you will ultimately do. But my goal, and that of your entire treatment team, is to ensure that you receive safe, appropriate care. It's tempting for all of us to jump straight to the end result, but I like to focus on the several steps. Number 1, we need to get you to surgery safely. Number 2, we need to get you through surgery safely. Number 3, we need to get you out of the hospital safely. Number 4, we need to get your wounds healed. Number 5, we need to get your bone or soft tissue healed. And number 6, we need to get you rehabbed. Challenges and complications can arise, unfortunately, at any of these steps. If you had a nerve block to help you with postoperative pain, it can last from several hours, sometimes even more than a full day. Once it starts to wear off, you should probably begin with your first dose of pain medicine. Alternating your pain medicine with ibuprofen or Advil can be extremely helpful with pain control, as long as you do not have an allergy to non-steroidal medications like aspirin or do not have another reason you should not be taking them. Occasionally, for certain conditions, I prefer my patients not to take anti-inflammatories. If so, I will have let you know before surgery. By alternating, I mean taking 1 or 2 pain pills, then 4 hours later taking ibuprofen, then 4 hours after that taking pain pills again, and so on. Generally, the first 2 to 4 days after surgery are the worst. Then things begin to improve. I often see things begin to take a bigger turn for the better around 2 weeks after surgery. Almost all of the prescribed pain medicine, Percocet, Vicodin, Tylenol number 3, Norco, have Tylenol built into the pill. Please do not take extra Tylenol in addition to those pills. Also, do not take more pills than prescribed. This can be extremely dangerous for you. While I do not want you in pain, it is my goal to have patients off of narcotic pain medications as soon as possible. For some conditions, this might be within the first couple of weeks. For others, it can be longer. As a general rule, you should only be getting prescriptions for controlled substances, including narcotics, from one physician. If, after receiving a prescription from me or one of my partners in my absence, you receive narcotics from another physician, you must notify my office immediately. It is for your protection and safety that having multiple physicians prescribing narcotics is avoided. If you do get narcotic prescriptions from other providers, I will no longer be able to write or prescribe any controlled substance prescriptions for you. The goal of the entire treatment, and much of orthopedics, is to improve your function so that you are better able to do the things you need to do as well as the things you like to do. Approaches to postoperative rehabilitation can vary widely from provider to provider. If we look historically, in orthopedics we have moved away from prolonged periods of immobilization and moved towards early motion and even early weight bearing in many cases. I am a big proponent of early motion and weight bearing, but injury, condition, other medical issues, or surgical factors contribute to make each patient unique. I cannot guarantee a perfect or even great outcome, but I'm a believer in doing it right the first time. If things do not go as planned, I try to include patients and families in those issues as early as possible. I may be old-fashioned, but I think that simple human-to-human conversation and communication, these videos notwithstanding, is the best way to keep us all on the same page. Few things in life are as stressful for us and our loved ones as surgery, even if it is described as, quote, just a knee scope or just a broken bone. Well, none of my patients are simply just anything. We seek to treat every patient with the respect and dignity that he or she deserves. On our part, we expect you and your family to do the same with us. In an environment of ever-increasing paperwork, rules, and frankly, confusion and uncertainty, the secret to your outcome is for us to work together. I look forward to seeing you in the office and follow-up. If you do not have your follow-up scheduled already, you want to call the office or go online to make an appointment for about 10 to 14 days after surgery. Again, if you have concerns earlier, however, I want to know.